All right, good afternoon, everyone. This is Marcia Hovey. I'm the chair of CADRE, Collaborating Agencies Disaster Relief Effort. On behalf of CADRE and the Silicon Valley Council of Nonprofits, we want to welcome you to the road to reopening. Today's session is designed to help our Santa Clara County nonprofits and community-based organizations understand the public health guidelines and share best practices of those who are already headed down the path. While we're doing this little bit of housekeeping, if you could please type your name and the organization you represent in the chat box. You're going to be kept on mute during the presentation. After our county council begins his presentation, we're going to turn off the chat box. And then if you have questions for the panelists, you'll submit those through the Q&A box, which is also at the bottom of your screen. If you want to share something about a topic, you can type that message into the Q&A as well, and we'll unmute you to share if time allows. Okay, next slide. The webinar segments include why we're here, the rules of the road, understanding the current Santa Clara County health order with a question and answer session following, creating a roadmap, general planning considerations, filling your tank, unique CBO considerations, the road ahead, when our CBO panelists are going to share their information and questions and answers as well during that time. And then the journey continues, our discussion about what's coming next. Over to CADRE's training consultant, Anna Swardensky, to facilitate the webinar.
Great. Thank you, Marcia. So hi, everyone. I'm Anna Swardensky. And what you see on your screen right now is our objectives for this afternoon's session. We want to start with giving you all an opportunity to hear and review the current public health orders and have an opportunity to ask questions. And for those of you who have submitted questions ahead of time, we have as many of those as we could answered embedded within the presentation. We also want to talk with you about basically a broad overview of considerations for you as nonprofits and community-based organizations here in Santa Clara County as you look to continue your service delivery and reopen your facilities in this COVID-19 landscape. We're excited to have also with us this afternoon a panel of your peers. We have 6 community-based organizations to share with you what's working in their own organizations, some of the challenges, tips, or best practices that they can share with you that have been working in each of their own individual organizations. And lastly, to share resources with you about operating in this new normal. So today is the first in a series of webinars that the Council of Nonprofits and CADRE will be offering over the next few weeks. In approximately 2-week increments, we're going to be doing a deeper dive into 3 other topics. So on June 23rd, we'll be doing a session more focused on physical design considerations and how you lay out your office space, common use areas, break rooms, etc. The 3rd session in our series, we'll talk a little bit more about staff care and making sure that we're taking care of our nonprofit workforce. And the last session is exploring shared space and talking a little bit about maybe having some unique and flexible workspace and arrangements in this COVID-19 context. And so that's what we have on deck for you for the next couple of weeks. So where are we right now? We put together today's session to provide additional information, clarifications, and basically to support all Santa Clara County community-based organizations and nonprofits as you look ahead in more fully reopening your community with new safeguards and protocols. So we know there are also a number of folks who are logging in today from our peer VOAD organizations. VOAD stands for Voluntary Organizations Active in Disaster. So we do know that we have some participants with us today from outside of Santa Clara County. We welcome you to listen and learn. A majority of our speaking remarks will be focused on Santa Clara County, and in particular our Santa Clara County public health guidelines. But we do hope that you'll find this information useful as you plan ahead for your own communities. So here in Santa Clara County, as of June 9th, a number of our counties have entered into stage 2, and that's what you see here on the screen. There are variations across the state, as I think we all know. And so to zero in a little bit more closely on Santa Clara County's public health order, we are extremely pleased to have with us this afternoon Tony LaPretis from the County Counsel's Office. Tony joined the Office of the County Counsel in 2018. He's a member of both the Social Justice and Impact Litigation section, Government section. He advises on Parks and Recreation Department and our Office of Supportive Housing. Before joining the County Counsel's Office, Tony practiced environmental labor and employment law at a public interest law firm in San Francisco. He's a graduate of UC Santa Cruz in Latin American Latino Studies and UC Berkeley School of Law. He's also a member of the board for California Rural Legal Assistance since 2015. Tony is part of the county's team that worked on the development of the public health orders that have been issued for COVID-19 and is here to help us all better understand our current orders that went into effect last Friday, June 5th. So thank you, Tony, for joining us. Please take it away.
Thank you, Anna. Thank you so much for the invite, and thanks to everybody for joining. I'd like to start, I think, by just expressing really a deep sense of gratitude from myself, from Dr. Cody, and from a really huge team in our Emergency Operations Center that's literally working day and night to try to move forward together through this crisis. I think we have done some amazing things in averting a complete catastrophe, and the credit for that really belongs to everybody in the county who has made really just extreme sacrifices in many cases. We know how difficult it has been to comply with these orders. And we also know how difficult it has been for, the nonprofit organizations in our county to adapt and at the same time serve populations that are experiencing need in ways that they really haven't ever felt it before in some circumstances. So I think it's important to really start with that. I also want to say thank you for everybody's patience in navigating what are really complicated orders that are just magnificent in terms of, they're enormous in terms of their scope, right? They really try to cover the entire functioning of society, which is not easy to do in one piece of legislation, and certainly not easy to do when you're, when you're drafting that legislation, responding to real-time developments in an unpredictable virus. And so, there are a lot of complexities and confusion about how these orders really hit the ground. And we really appreciate folks' patience and assistance really in understanding where that confusion lies and figuring out how to clarify the orders. In that respect, what I'd like to do is just kind of walk through what the orders say, where we're at now, say a few words trying to address some of the questions that have been posed. But I would really like to take additional questions that people have, but also provide an opportunity for input, because I think one of the things that I've learned is that the ground truthing of these orders really happens in forums like this, where we're able to collect input from people who can explain what they're seeing on the ground and you know, what needs to be changed or modified. So let's start with this slide that we just changed to here, which is just a quick recap on how we got here. So that last picture that we saw up there was a picture of the health officers from the 6 Bay Area counties, the largest population Bay Area counties, and the city of Berkeley has its own health officer. And these groups, these health officers came together to issue the first shelter-in-place orders really in the nation. And Dr. Cody and Santa Clara really took a leadership role in issuing that health order, that first health order back on March 16th. If you could go to the next slide, please. I think what you see in this graph that it's a little old, was actually published back in April, but you see here a representation of what our caseload would have been if we had not issued these shelter-in-place orders, which is the red line, versus where we ended up in the gray because of the shelter-in-place order. I think we've actually done quite a bit better than that. As our current case count shows. You know, I think acting early saved tens of thousands of lives, not just here in the county, but it also, I think, was a precedent that the state followed just a few days after we took action, and many other jurisdictions, as we all know, quickly followed. I think it's an incredibly difficult move to make, to shut down society, as you can imagine, and I think it was a very necessary one. What we've been doing since the first shelter-in-place order was put into effect is looking at the data regarding the virus and trying to adapt the orders based on what the data tells us is the current state of the risk. And so we are now in our 5th shelter-in-place order. We have really in the 3rd and 4th shelter-in-place orders, Dr. Cody took real baby steps in opening up some of the economy and some of the activities. But what we see in this last one is really a leap, where we were opening 2, 3, 4 sectors at a time before. We opened 14 different sectors and activities in this last order. There was a real sort of ratcheting down of a lot of the restrictions. And I think what that reflects is that the trends in the data are really pointing in a positive direction for the most part right now. So, we're finally at a place where most businesses, organizations are allowed to operate with limitations. There's still a long way to go because there are some sectors that can't operate, and because we are also, making sure that there are limitations on how those businesses, organizations, and entities operate. So, this last point here says we're still a long way from home. I don't know that we'll ever get back to the exact same normal that we were at before. Things are gonna look different, at least for the foreseeable future. But we're still a long way from getting everybody up and running. And, we're, if you can just take go to the next slide here, please. Thank you. I think what we're hoping to do is to continue moving in that direction, provided that we don't see another spike in the cases that are coming through. So this chart is on the Public Health Department's website. It provides probably the quickest and easiest summary of what's open now and what opened on June 5th. There's some significant points in terms of the June 5th order. You see low contact services opening, the first dine-in, being able to open an outdoor dining, manufacturing and warehousing and retail. And you see a lot of activities opening up for the first time in a long time, which is allowing some outdoor religious gatherings, and ceremonies to resume, and then outdoor recreational activities are allowed to resume for the first time since March 16th with members of one other household. So different households can go out and recreate together. And there's also a little bit of a loosening on the summer camps and summer schools, where those are allowed to proceed still in stable groups of 12, as has been a case for a while, but the groups can change every 3 weeks instead of every 4 weeks, as was the case before. Next slide, please. Thank you. So essential businesses that were identified in the March 16th order are unaffected by the recent orders. They're allowed to continue operating as they were before. They're subject to the same limitations generally that they have been subject to. Nonprofits that provide food or shelter or other necessities to economically disadvantaged or vulnerable communities have always been deemed essential in the shelter-in-place orders. That continues to be the case. There was a question about how economically disadvantaged is defined, and the answer to that question is that the order doesn't define what economically disadvantaged means. It's not defined in our voluminous FAQs that folks should refer to as a resource. And the reason for that is because it is really something that can mean very different things in different situations. The intent of that provision is to allow nonprofit organizations that are principally providing, their mission is devoted to providing these services, to allow them to continue providing those services. We've seen some instances where groups that don't fall within that category have tried to take advantage of it. For instance, we had a school that tried to open because it said that 20% of its students were economically disadvantaged. That is certainly not the intent of that provision. We also saw situations where you had nonprofit organizations that had some component of service provision, but they also did other things. For instance, a Goodwill that provided services and could continue to provide those services under this provision, but also had a retail store. That retail store isn't sort of shoehorned into this provision. That retail store is governed by the standard provisions in the order. And the way that this is moving along at this point is that Dr. Cody is looking at the data and making decisions about what moves we'll make in terms of opening, or if the data turns closing, depending on how the data reacts after a full incubation period of 14 days. So roughly, we've been making changes to the order on 14-day increments. Next slide, please. This is a screenshot of the social distancing protocol, which I imagine many of you are familiar with. Every single business broadly defined, so any organization or entity that operates a facility in any respect in the county has to fill out one of these social distancing protocols, has to provide it to every single one of its employees, and then also has to post specific signage. Generally, what this social distancing protocol does is it lays out the rules for how businesses operate to ensure that we're minimizing risk when facilities are being operated. You can go to the next slide. You'll see there are 2 pieces of signage that have to be posted at the entrance of any facility that's being operated. And to be clear, that means if customers access it, obviously, but also if personnel are working there, then you need to have this posted on the entrance to the facility. This is sort of a summary. And then the next slide is a graphic that was created so that people can easily recognize whether a business is complying with the social distancing requirement. Next slide, please. As I said before, it's really important, especially as we open up more, that there's strict compliance with these social distancing protocols. This is going to be the means by which we open up and still control the virus. I think everybody's faithful adherence to this could make the difference between having another spike or not having another spike. And so we're going to be looking for people to be carefully complying with the social distancing protocols as we move forward. Next slide, please. Just a few points of clarification. This is reflecting on a couple of the questions that were submitted. So there is a requirement in here for temperature screening, which has caused some confusion, some understandable confusion. Temperature screening does not mean that temperatures actually have to be taken by a business or an organization. What that means is that there needs to be a screening about temperature. So you need to ask the employee whether they have measured a temperature or whether they've been feeling feverish before they enter, as well as asking them about other COVID symptoms that they might have. If there is any sort of actual temperature taken, it is optional, and organizations or businesses could do that. Then we would generally advise, the public health department would advise that people be sent home if they're above 99 degrees. There's a question about the sort of frequency with which different common areas should be sanitized. There's no standard for this. Probably the best resource would be to look at the CDC's website that talks about sanitation protocols. It really depends, I think, on the facility and how often it's being used. There was a question about hydration stations. The public health department has advised and required that water fountains be closed and not operated, but something like a touchless hydration station can certainly be open. I think, within our own park system, we've been very concerned about people having access to water. We certainly don't want to replace one public health crisis with another public health issue. So we want people to have access to water. We just want to make sure that we're being careful with the facilities that are providing it. There was a question about organizations' responsibility to enforce the face covering rule. As you probably know, and as a social distancing protocol and the order require, anybody who enters into a facility, once they're in that facility, whether it's inside or outside, has to be wearing a face covering. Except for people who have a health condition, who are under age 6, who are otherwise unable to wear a face covering, for example, because they can't remove it on their own. So there's a question about, what a business needs to do to establish that somebody, falls within one of those exceptions. I think, generally, first of all, the order doesn't require that the business take any specific steps here. The businesses are responsible for enforcing the face covering rule, but we certainly don't want people out there, asking for paperwork showing that there's some sort of medical recommendation stating that they shouldn't be wearing a face covering. I think it's up to the business to figure out how exactly it wants to do that. But we don't require as a county that there's some sort of prove up on that, on the qualifying for that exception. And there was a lot of questions about these occupancy limitations for essential businesses. So, there's a couple points here. So one is, for essential businesses, the social distancing protocol states that you have to maintain density limitations that allow for easy separation of at least 6 feet at all times except when necessary. So, what does that mean exactly? It's really facility specific. You want to bring people into your facility in a way that they're never going to be in a situation where they have to be in close proximity to one another, unless it's some sort of transaction or function of the facility that requires closer contact. So for instance, if you're doing some sort of healthcare, obviously there's going to need to be touch in certain instances, and the order doesn't prohibit that. But it's up to you to sort of understand your facility, understand how big it is, the flow of the people in it, the flow of the workers in it, and make sure that you're not over densifying it such that people can't maintain their social distancing. Now, there is an exception to that sort of general limitation, which applies to the businesses in the appendices. So in Appendix C1, there are some specific density limitations laid out. So for instance, all in-store retail you can only have one personnel per 300 square feet and one customer per 200 square feet of publicly facing area. Manufacturing, for instance, allows only one person per 300 square feet. So those are limitations that are a little bit more extreme and obviously more delineated. And the reason for that is just because Dr. Cody has identified those as being higher risk and wanting to make sure that we're maintaining even more of a limitation on the density there. Next slide, please. So this slide provides answer to another question of who should be contacted if someone contracts COVID-19. Of course, as soon as I created this slide and sent it in to Anna and Marcia, I got an email saying that the phone number wasn't working. So we are working on trying to resolve this phone number issue. I believe the email is functioning just fine, and hopefully we'll have the issue with the phone number resolved shortly. Next slide, please. This is just a reminder that people need to be wearing face covering. I think to the extent that you can provide signage reminding people, that's very helpful. Next slide. So this is a statement that the Public Health Department put out from Dr. Cody, just reflecting on the current state of the world as we see it. So as you can see, she's really reflecting here on a moment that's very difficult, obviously for a lot of people, and also for Dr. Cody and for the Public Health Department, for everybody who's been in the EOC. It's an incredibly challenging moment. You've been doing everything you can to keep people apart, and you have a situation where people want so desperately to come together to express their views on an incredibly difficult situation. I think the public health world and Dr. Cody recognize that COVID-19 is a life or death matter, and so too is the police brutality that has really been rampant in our society. And there's an understanding that people are going to be out there protesting, there's a couple things that the Public Health Department is really focusing on here, which is making sure that people understand that if they are out there protesting, they're at a higher risk. And it is important to really encourage those folks to go get tested. We have the testing capacity right now for people to go get tested. They've been in those situations, and they should definitely do so. And I think it's also just important to point out that expressing views on the current state of affairs and being safe are not necessarily mutually exclusive, right? There are a lot of creative ways to make your voice heard and to weigh in on this situation. And we certainly encourage people taking advantage of those alternatives to minimize the risks here and to avoid us backsliding on a crisis that's been so hard for people. Next slide, please. So this is pretty much, I think, the end. Is there anything else in here, Anna?
No, I think we were ready to go to some of the Q&A that was submitted, starting with just a couple of the questions that came in via registration, and there's a handful that have come in live this afternoon. So if you do have a question, please type it in the Q&A box. But a couple of questions, Tony. Should nonprofits have staff and volunteers sign any kind of liability waiver coming back to work? Is there a county recommendation on that?
So I hate to be the lawyer, but that's really an issue that you have to take up with your individual council. It's not something that the county can advise on. I think it's a very difficult situation for a lot of organizations and businesses, to say the least, and we understand how difficult that is. Workers' compensation is going to come into play in a lot of these situations. It's important to sort of understand where you are with your insurance company. And I know a lot of organizations and businesses are thinking about liability waivers, but not something that we can advise on directly.
Okay, and we had another question about employer responsibilities as it relates to contact tracing. Any thoughts about that? What are the employer's responsibilities with respect to contact tracing?
Right. Well, it's gonna, for the most part, what we're looking for from employers is that they're cooperative in contact tracing. This is one of the most important and powerful tools that we have to contain the virus. We are doing a lot right now to try to scale up our capacity to do case investigation and contact tracing. It is essentially what we do to make sure that an individual, when they've contracted COVID, that individual is not spreading it to others that they are in contact with, and to the extent they have already been in contact with other people, that those folks are self-isolating and taking the necessary measures to understand whether they've contracted it and aren't sort of in public settings. So we want employers to work with us to the greatest extent possible to understand what kinds of contact there has been between anybody who's tested positive and others in the facility or the general public. In some cases, for instance, in the construction context and for some of the activities that are allowed in Appendix C2, like the outdoor religious gatherings, for instance, there is a requirement in there that names and contact information is collected so that we're able to do contact tracing more effectively. Okay.
Marcia, do you want to jump in here with some of our live questions?
Sure. I was just answering one. Is the social distancing protocol?
Oh, we're losing you, Marcia. I missed that last part. I just heard, is the social distancing protocol?
Okay. Is it mandatory for outdoor events?
Yes. Anywhere that you have any facility, and that would include an outdoor event facility, you would need to have it. So, if you were going to have some sort of ceremony, for instance, in a park, and you had a particular area, you would want to post it. If you were a camp, for instance, and you were running a youth camp, you would want to post that, like on a sign, for instance, or at the front table where people check in. So any facility where you have employees or customers or people, you're going to need the social distancing protocol. The only exception to that is construction sites, which have their own protocols in the appendices that they have to fill out.
Thank you. If an employee enters an office wearing a mask while they're in common areas, do they need to keep continuing to wear the mask if they're in their private office?
Yes, they do. It's anytime you're in the facility. Of course, you can take off your mask in order to take care of any sort of personal needs like eating or drinking, for example, but you do need to have that mask on while you're in the facility.
Okay, and then as summer returns, where'd that one go? I just lost it. As summer returns and families return to going out together, do families count in the space limitations? And this was asked right after you were talking about the 200 square feet, I think. So how would you count?
Yeah, they do. In many cases, households are able to interact in ways that people in separate households aren't allowed to interact. You don't need to have the social distancing. But when you're in a facility, households count, each member of the household counts as an individual person and has to be counted as such.
Okay, and then if we already have Appendix A, because there was an earlier version of Appendix A that was 3 pages long, I think, do we need to fill out the new Appendix A?
Yes, absolutely. So when that order came out on May 18th, it stated that the new social distancing protocol had to be filled out by the time that order went effective on May 22nd. So that's that is the current social distancing protocol, and you have to have that one filled out and distributed to all employees. The old one isn't operative anymore. There are a lot of new requirements and different requirements in the updated social distancing protocol.
Okay, let's see. For the data that Dr. Cody is looking at to determine when to reopen things, can you talk about the types of data?
Sure. So I think probably the easiest and quickest way to get a sense of some of the key data points is to look at the order itself, which has 5 indicators that are baked into the orders that the health officers are looking at in the Bay Area, Dr. Cody included. These include things like what's the case count, what's the hospitalization numbers, how much PPE is available, what is our testing capacity, what is our contact tracing capacity. That's not, however, the sum total of the data that Dr. Cody is looking at. She's also considering trends, other trends within the county, like what's the reproduction rate, what's the positivity rate, that kind of things. Those kinds of things, and then also looking at what's happening around her. So what are the trends in the counties that surround us? What's happening statewide or nationwide? I think all of that figures into an overarching risk assessment. That's one of the reasons why it's so difficult to and why we haven't said, if we get to X point on one particular data point, we will open Y business. This is really a sort of cumulative assessment, and Dr. Cody needs to look at all of that data collectively in order to make an informed decision.
Okay, how about for in-person meetings, are they allowed with social distancing and wearing a mask, and is there a maximum number of people?
So it depends. Meetings would be allowed if there is a business that's allowed to open. Then meetings can take place within that context of that business. So an essential business, right? If folks need to meet in order to carry out, the functions of that essential business, then they can do that. But they have to do it in compliance with the social distancing protocol that would require them to wear the masks and maintain that distance as well.
And I think there's one more I think is interesting. I wanted to bring this up. For hard of hearing, masks make life difficult. Are face shields okay for those populations?
Yeah, so face shields are not an adequate substitute for face coverings for a lot of reasons related to sort of physics of the aerosolization of the virus, as I understand it. There is a limited exemption if you look at the guidance that allows for the removal of face covering if there's somebody who's hearing impaired and they need to lip read. And there are some instances when presentations can be made without a face covering, but for the most part, they do need to be worn at all times when in a facility.
Okay, I think I'm going to cut in here, Tony. We have a number of other questions that are in the Q&A box. We're going to move on, but Tony, if you have a chance to look at any of those and type in an answer, and if not, for our participants, we do have Tony's commitment to work with us after today, along with the public information officer for the public health department, to get as many of your questions answered and posted to our CADRE and Council of Nonprofits website. So if you'll bear with us, we have a lot to present to you and a number of other speakers. So, close out Tony's Q&A session with a big hearty thank you to you, Tony, for all of your work with us and your sharing of your information and knowledge. And we're going to keep moving on.
Okay, well, thank you so much, Anna. Thank you, everybody. Best of luck and be well.
Okay, thank you, Tony. So at this point, what we wanted to do is we have 2 quick polling questions for all of you on today's call. Wendy, Wendy's queued up. How many of you have filled out Appendix A for Santa Clara County? I'll give you a few moments to log in on that one. And I know we have 133 participants right now, so we're gonna let those numbers climb up a bit before we move. Okay, so only about half of you are voting, so I'm not sure. Okay. Well, that gives us some data. It's about even of how many of you filled it out, how many of you have not, and it's the first time you're hearing about it. Okay, so our second question for the group today is, have you, oops, here we go. Can we put up the second question, Wendy? So how many of you have some workplace safety protocols already developed for your staff check-in at each of your offices and work sites? All right. Okay, well, some good data. More than half of you have some workplace safety protocols already established. And so that gives us a little bit of a snapshot into, kind of where you all are as a group of community-based organizations and nonprofits. Let's go ahead and keep moving. We want to give you some more information for your own individual organization planning. So with that, Marcia? Oh, you're on mute.
All right. Okay, so first we're going to talk about creating the roadmap, and I'm going to talk really fast because I want to get to the other presenters. There are many guides, playbooks, and webinars that have been published in the last few weeks, I'm sure you've noticed, on how to reopen offices. And Anna and I have reviewed this guidance with FEMA, CDC, Cal OSHA, local organizations, the state, other states, and the private sector. A lot of it is the same. So we're not going to give you a big repeat of that, but today we're going to give you a big picture roadmap that includes actions specific for nonprofits and CBOs. And then our panelists who are already headed down the road will offer their best practices. Next slide. So what do we need? We need a plan. We need to document the plan. That'll be filling out Appendix A to start with. And then messaging, signing and training, facility, workspace readiness, and cleaning and sanitation and emergency procedures. And I'm going to talk about each one of those briefly. So to develop and document your plan, we're still in disaster mode. So as you plan, you've got to consider what your disaster mission is, what are your essential functions that you must carry out, and then some other things that are still going to have to be set aside for now. But you start planning with the essential functions and how do you get those back into your environment with the social distancing. So fill out Appendix A. It will require discussions with all of the parts of your organization. Your plan will have phases that will eventually establish a full organization functionality while leveraging non-traditional and flexible work arrangements. Your plan's not going to look like anyone else's, and be creative on how you adapt. This is a great opportunity to change things that might need to work better next time. Think about who needs to be in the office and who can work from home. The more that can work from home, the better. Different ways that you can reduce contact within your facility, and then just taking small steps. You're going to keep adding to this plan as you continue to get feedback. Next slide. The messaging and signs and training, a common theme in the guidance, in all of the guidance that I've read, says you can never communicate too much with your staff or your clients and customers. So be redundant. Determine what methods you're going to use to inform employees and clients and customers, vendors, and other stakeholders. For staff and volunteers, explain what the process is for returning to work. What is that process? What will it look like? Appendix A says to explain to them about PPE and social distancing practices. But there are other things to consider. People do not like change. None of us do. And so all of this has been an experience, but they also don't like to have things sprung on them. So prepare them for re-entering the workspace so that they know what to expect. Are there going to be staggered shifts or alternate work days or staggered breaks, changes in the break rooms, more hand sanitizer? All of those things are important to staff. And then consider providing Zoom sessions to explain and answer questions before you open up, and answer all of their questions and get their feedback before you open up. And then lots of signs all around the facility to remind everyone of what they've agreed to. You do have to send a copy of Appendix A to every employee. You do not have to post Appendix A. You just have to post those, the check mark and that summary sheet. So I know we get that question a lot. And we were just talking about signing risk waivers. Anna and I are creating a resource guide that'll get posted shortly after the webinar. There's some sample wording in there if you don't have someone that can give you the wording that you want. But you really just want to have them acknowledge that this is a fluid situation, that we're doing the best we can. We can't prevent everything. And so that they just acknowledge that they're at work with that understanding. And let's see. Make sure that the vendors who are going to come on the property know the procedures as well. And then establish a way for employees to offer feedback, corrections, and suggestions, because your plan will not be perfect. It should keep evolving. Next slide. For facility and workspace readiness, our next webinar is going to cover this topic completely, but this screenshot just shows a little bit of one of the big questions is what happens if an employee gets sick on the job. And so this is a sample that Kaiser Permanente put out. It can be even simpler than this now because we're not just testing people that are high risk, we're testing everyone. So it could be as simple as you get sick, you go home, you seek medical attention, you get tested. When it's 10 days past your symptoms and you haven't had a fever for 3 days, you're good to go. And then the next slide. So this is going to get covered next week as well, but I like this slide from Perkins and Will, who they're just talking about some of the little things that you might not think about that will make the employee experience better. So on the left is the employee experience of creating them a welcome packet, if you want to, with some things in it that you think they'll need that they might not have on hand. And then supplies to just make sure that the facility is going to stay clean, like small covered trash cans and caddies for supplies. So this will be done in more depth, but I just wanted to share a tiny bit. Next slide. Then for cleaning and sanitation, the first thing is just to make sure that you have checked with the supplies that you're using that they are on the EPA list, that they are a disinfectant that will actually kill COVID-19. We will provide that link to you. And make sure that you notice how long that the product needs to stay on the surface in order to actually kill the virus, because some of them are 10 minutes, 30 minutes. So you want to look at that before you decide that that's the product that you want to use. And then just understanding that there's going to be a lot more cleaning happening. Let's see, a lot more cleaning and sanitizing that's going to go on all day. You'll get to decide what, when, and how you're going to clean the high touch surfaces. And then in Appendix A, it says to create a schedule for break rooms and bathrooms. And again, it's going to depend on how often those get used for your facility. Finally, I noticed in one of the guidance documents, it said that you shouldn't use fans to recirculate room air, which could imply that bathroom air-powered blow dryers might not need, maybe they shouldn't be used either because it's just pushing the air around more. So just something to consider. And the next, the emergency procedures. So this is how can fire alarm drills be modified to minimize exposure? I think probably the easiest way would just to evacuate different portions of a building instead of doing a full evacuation. If your fire marshal is still requiring you to do those, just do portions so that you can keep people apart. If you do have staff response teams and they're supposed to be kept in refresher training, depending on the type of training that you need to give them, you may be able to do that through Zoom. Think about your evacuation procedures and your assembly areas for earthquake or fire. You may have to remind people to spread out more once they're outside, or add some more assembly areas, or spread out the assembly areas. And then shelter in place. Remember when shelter in place meant duct tape and plastic sheeting? So if there are hazardous materials events outside and you do have to turn off your HVAC and stay inside, just think about that as well. And finally, checking your first aid kits and first aid stations to make sure that the supplies are still there and that the personal protective equipment hasn't walked away. And I'll turn it back to Anna now.
Okay, thank you, Marcia. The next segment, we wanted to give you just a couple of considerations that we found as we were doing our research. One of the things we found early on in planning for today was a guidebook that was developed by the Oklahoma Center for Nonprofits called Going Forward, Best Practices and Considerations for Nonprofit Re-Engagement. The guidelines in this material were developed by a task force of nonprofit and faith leaders. And so we wanted to give you a few of the nuggets from that guidebook, and know that you can download the full resource once we put up the resource list on the CADRE website. But a couple of unique things. As nonprofit and community-based organizations, one of the first things that we can acknowledge is that we have this call to serve our communities and our residents, whether you're a shelter, a museum, or an arts program, a dog rescue group, a place of worship, a counseling service, or one of any of the other hundreds of types of services that our community and nonprofit sector provides. We wake up each day ready to go out into the world and do good in everywhere and in every way we can. And so with the pandemic, somewhat, kind of the unthinkable happened, yet through all of that, our sector continued to do good. And in some respects, as you'll hear in just a few moments, our sector never closed. Many of you had to pivot very quickly to provide your services virtually. You changed how you ran your organizations. You adopted new health protocols, all the while expanding your service clientele. And now we're beginning the more methodical practice and process of opening our offices more fully. And so, as Marcia and Tony have shared, there's a lot to think about and a lot to plan for. And we know in the conversations of just this past week or two, the concepts of equity and inclusion, we need to consider the impacts that this event has had on some of our communities' more vulnerable and marginalized populations. And so with that, one of the things I thought was unique in this guidebook was something they called an oath of personal responsibility. As nonprofits, we're full of huggers and handshakers, and it continues to be hard, but we know that we need to avoid physical contact. So what you see on your screen is an oath that the Oklahoma Nonprofit Guide put out there just for consideration. It's designed for staff, board members, frequent visitors, your clients to consider adhering to. And it's not legally binding in any way, but it's meant to serve, I think, as a reminder to all of us of our responsibilities, both inside and outside of the office, to practice social distancing, good hygiene, disease detection and management, because basically what we do in our off time will impact what we do in how we are able to work with our coworkers in our own programs as well. So there are any number of HR considerations for staff and volunteers who are the lifeblood of our programs. And so there'll be another session in this series that will do a deeper dive into human resources considerations. And I think that you'll also hear from our panelists in just a few moments how some of them have been able to adapt and put together some good tips and best practices to share with you. As nonprofits, we know we have kind of a board governance structure. So remember that, and that's unique to our sector. Our boards are meant to govern, not necessarily manage. So recognize that in a crisis, there's a balance between governing and managing that can shift. So be mindful of that as you plan forward. Be engaged with your board regularly if you haven't already been doing so. One of the tips they gave is to actually talk with your board members about their assistance or advice, particularly thinking about what board members do you have that are already engaged in the reopening process, perhaps in their own workplaces or companies, that they might have some tips for you in your community-based programs. Keeping them apprised of everything that's going on, and you know, making sure they understand what their roles and leadership responsibilities are. As nonprofits too, we oftentimes have lots of events and donor relations. So we know that these have been impacted by COVID-19, the number of people that are allowed to come together, the social distancing tactics that we need to observe, the PPE supplies and food handling considerations are all a part of what will become our new normal. So we need to be mindful of this. There's some different tips up here on the slide, and to be thinking ahead of time, as I'm sure you all are, about the different contingencies that we need to have in place around events, whether it's postponement, cancellation, or changes in plans. And so without further ado, I want to move us to our panel of your peers and a sharing of best practices and tips. We have brought together some organizations that have done some pretty amazing work over the past 12 weeks since the initial shelter-in-place orders were given. As I said earlier, they pivoted quickly, they adjusted for and planned for their staff and volunteers, expanded their service delivery, all the while staying in line with our changing public health order, and they've made us proud. So today we bring to you 6 different organizations, and we're going to start off with Bruno Pillay from Second Harvest.
Good afternoon, everyone. Bruno Pillay for Second Harvest. So yeah, one of the specificities of Second Harvest is that we actually never stopped working, and more than that, we actually doubled our activity as measured by the number of people that were served and the amount of food that we have distributed in the 2 counties. So with that in mind, we looked at the whole adjustments that we had to do from 2 angles. One is obviously for our employees. We have about 200 employees. Some of them are office employees, others are in the warehouse, drivers. And then I will speak in a second slide about what we have done for volunteers, as obviously we use a very large number of volunteers by the hundreds on a weekly basis. So first starting with employee, what I call phase 1 is up from March 16, essentially up to the latest health directive that we got, has delineated in the Appendix A, the first and then the second. And during that phase 1, we basically had to look at everything we were doing in the lenses or through the lenses of social distancing and preserving the health of everyone that we were working with or serving. So like a lot of other regular businesses, we obviously started by encouraging a lot of people to work from home. at least all the ones that were in office kind of work. That was not always possible. We have a hotline that has to stay in the office. We actually brought a pretty large number of additional temps and National Guards to man this hotline. We just distributed them across the empty spaces that were left by the people who were working from home. And then obviously we have all of our warehouse workers and, sorry for that, and drivers who actually had to work. So for them, it was essentially about making sure they were applying the practices that were recommended at the time. It took a bit of time to decide for face masks, but we basically went to face mask for everyone, gloves for all the interactions when it comes to manipulating food. And then ongoing cleaning of the office. We have had people actually basically cleaning all office space on a daily basis every day, both public as well as knobs and doors and all of that, so that those people are just running around cleaning the space. And then we set up procedures in case of health concerns. So anybody that were thinking that they had some sickness of some sort, we're not sure, we have been in contact, so we required that those people immediately stay at home. We changed the sick leave policy to add 10 days sick leave so that people could feel good about staying at home. That was a very important element, and obviously time off flexibility if people needed to take time off. During phase 2, so that's where we are right now. As soon as the Appendix A various versions came up, we implemented all of them, including training. So we have asked all of our employees to read the necessary documents as well as watch a number of videos about everything required regarding safe handling of and behaviors in the current conditions. We have maintained working at home facility policies, so pretty much everyone who didn't need to be in the office and or felt that they had to stay because they felt at risk, so they obviously are encouraged to work from home. We are currently assessing space availability. As I mentioned, we've brought a lot of temporary people to pick up some additional load that we had. So space has been taken. We cannot use every office space. We have alternative spaces, so one occupied, one empty, one occupied, one empty, kind of arrangement. And so as long as those spaces are occupied, obviously people will have to stay home. We are looking to reauthorizing air travel. Summer is coming. People may want to go out with family, go East Coast or wherever. Our approach in here is that we will take full advantage of the new facilities in terms of testing to recommend people for testing after they come back from travel, and or recommending them to stay at home. That's currently something we are in the process of formalizing. It's not formalized yet, but it's obviously something to be thought about in the context of summer vacations. Then, like you've seen a lot of other businesses installing plexiglass protections, like in the lobby and other areas. We have a lot of partners who come to the warehouse to pick up food. They're interacting with employees, so we can set separation there. Lobbies, of course, is another areas and a few spaces like that. So that's for employees. Next slide. Another big consideration for us is obviously volunteers. We have two kinds of volunteers. I would say one set together with the National Guard, which are working in-house in our warehouse. So they're basically making boxes of food. That was a challenge, to be honest. We have on any day something like 200 individuals who are either National Guards and or volunteers boxing food at any of our 3 facilities where we do those kind of operations. I'll show a few pictures later, but so we had to basically circle space, make sure people wearing masks, wearing gloves, cleaning obviously of any surface which is in use on a regular basis is obviously something that we do ongoing. And then for our volunteers outside, same kind of obviously approach, distancing. We obviously, what a big thing I should have mentioned is that we very quickly change most of our procedures to actually deliver food from boxes. So those of you who may be familiar with our operations, we used to have a market style approach and client choice. So very much like anybody going to a regular market. That's something that we had to stop pretty fast, and we pivoted to actually box the entire amount of food that we distribute at most of those sites, and then went into mostly drive-throughs. We have now more than 120 drive-throughs across the 2 counties. All of that obviously to minimize any interaction between people as we distribute the food. We requested that volunteers who could be in the higher risk categories would not come and volunteer, and so we basically shifted as well to other kind of volunteers. And for clients, we started a pretty large operation of home delivery, either directly from the food bank and or with partners. We serve them twice a month on food. And here again, we had to train drivers about safe practices to deliver the food, avoid contact, and so on. I mentioned cleaning, signage. So obviously at all our sites, as well as in the office, to promote social distancing. To be very honest, this social distancing is the one most difficult thing to maintain. Especially when people are in action, and you will be amazed at how quickly people get close together as soon as they get absorbed by the activities they are in. And so you need to have people who are always thinking about that and maintaining it. And then here you have a few of the pictures. On the left is the little look at how the warehouse boxing and sorting has been set up. So you can see the spaces. You can see underneath that the person, volunteers, basically all set up for the food distribution. And then after the Appendix A came, all of the posting that we had to do, as well as some kind of physical barriers that you could see this table, which actually to maintain people behind the table when they talk to the lobby. That's in the meantime, before we had the plexiglass things in place. And we have temperature check. And one more thing I want to add is we actually ask every single employee, so every day we have to sign in on a little spreadsheet, and where we basically guarantee that we have less than 104 degrees of fever, and that we have none of the listed known symptoms of the disease. And that's enforced. Every employee, as well as every temporary who come to the office, have to sign that before they come to the office. So that's one little way. And if people come to either ask for food or whatever at the office, we request mask, as well as we have a temperature check. So obviously one of those little temperature gun that we use for anybody entering the office to make sure that we have some kind of control. So very quickly, that's what we have done at the food bank.
Thank you, Bruno, and thank you for all the good work that your organization continues to do. Our next speaker is Jennifer Long with Catholic Charities. Jennifer is the Director of Compliance and Quality Assurance at Catholic Charities, Santa Clara County, and she had some things to share with the group as well.
Hi, so similar to what Bruno has mentioned, we haven't closed down. So for us right now, it's really expanding our in-person services. So for our agency right now, what we are encouraging, like everybody else, is if you're able to successfully work from home, please continue to do so, and come to the office if needed, if it's like, let's say, making copies, or if there's any client meetings that you have to go to. What I'll be focusing on mostly today has to do with the Appendix A, the social distancing protocol. So for those who haven't read it yet, as you go further down, there's a section that talks about personnel training. So for how we did it was we created the training materials. The materials is really gathered from the CDC or the Santa Clara Public Health Department itself. And what we did was in one of our weekly management meetings, we went over that with management, and the expectation is that they take this information and then pass it down to staff in their weekly meetings. And what we also did too, just to ensure that staff does get this information and that they do know the protocol, is that we uploaded these documents into our payroll system. So when staff enters in their time, they're prompted to look through these materials. So then for us, we use UltraPro. So they're required to download these documents, and also required to click saying, hey, I acknowledge I received this and that I will adhere to these, the training materials that we provided. So what HR has been doing for us is that every few days or every week, they've been sending out reminders to management team to let them know, hey, Jennifer hasn't signed this yet. Can you please ask her to go to the system, download it, read through it, and sign off? So that's kind of how we're tracking to make sure that people do get this message. And for our own employees, sometimes they may work at more than just one location. So when we provided the social distancing protocol, we actually had all our locations on there too. So if needed, they could go through that one document to look for the location that they're going to. Another thing that we also wanted to share was about, I think Tony talked about it, was about the building capacity. So as of right now, we operate out of 15 plus locations. Not all locations belong to Catholic Charities. Some of them belong to the schools. So we've been working with the school districts themselves or with the different owners as to, hey, how do you want to handle this building maximum? So for us, the example I'll be using is for our administrative building. Within our building itself, there's at least 10 plus programs. So for us, it's more like, okay, if we set the maximum to 60, how does 60 work? How do you make sure there's no more than 60 at any given time during the day? So the exercise we performed was talking to each group and asking them and taking into consideration, hey, with the 6 feet distancing and 300 square feet, like how many people can you guys have at any one time? What's your maximum number? Because at the end of the day, what we're asking for the team is that they know their programs better than we do. What schedule works best for them? For some, maybe it's an A-B schedule. For some, it could be an alternate day. So we're letting them let us know what the number is supposed to be. And from those numbers, what we've done is take that cumulative number and then we added in a buffer. Because at the end of the day, you may have like the UPS man that come in or the mailman, or let's say something breaks down and your furnace breaks down. So there may be vendors that also come in. So we added a buffer to make sure that we're set in our building limits. And what we're also doing too is that we're gonna have someone at the front of the building, and they'll be the one screening questions, taking temperature checks, and also be the one counting with a ticker as to how many people are currently within our office location. Next slide. But I think the biggest advice that we have is really having the ability to pivot and make changes as needed, because some orders come in every single day or a week or a month, and everything just changes a lot constantly. So it's just being able to adapt quickly to what it is that you need to do to be in compliance. So one thing is that when we have these client meetings, what we have is these plexiglass in between us and the client. And what we've been doing is there's one instance where we couldn't get one in time. So thinking outside the box, what we did was get like some clear shower curtains and put it down as a temporary measure until we're able to get something in place. But yeah, once again, the biggest thing is just being able to pivot and think outside the box to make sure things are done on time. And that's it.
Thank you, Jennifer. Some really great ideas. Thank you for sharing. Our next speaker is Sherry Burns with the Silicon Valley Independent Living Center, and she's the CEO for our ILC. Sherry.
Afternoon, everyone. My presentation is going to be split into two areas. The first slide is talking about basically our work while we've been sheltering in place and working remotely since the middle of March. And that has been focused a lot on advocacy and making sure that the residents and workers within our community have their needs addressed as well for safety and health. So some of this community advocacy that we've been focusing on with regards to access and functional needs is to try to make sure that we're able to acquire PPE, or at least surgical face masks and gloves, for all the IHSS and private caregivers. There are 4.5 million caregivers, both paid and unpaid, in the state of California, and approximately 150,000 just in Santa Clara County. 25,000 of those are estimated to be part of our public authority caregiver registry. And they are at risk in providing services for older adults and people with disabilities that rely on their care in order to maintain their independence. And of course, many of these folks, if not the majority, are a part of the population that needs to be sheltering in place and away from direct possibility of being near somebody who's COVID positive. So we have done a lot of advocacy in that area. I'm happy to say that the regional centers for our areas, the San Andreas Regional Center, or SARC, and the independent living centers for us, it'd be SVLC in Santa Clara County, are now well stocked with PPE, and we're giving it away to these groups. And so folks can access it through those agencies. Also assuring that the county COVID-19 testing sites are accessible to folks that need to walk or roll in, as a lot of folks don't drive, especially, again, our older adult population and people with disabilities rely on public transportation, and they might not be able to have somebody take them to the site. So working with the county PIO and health officials to make sure these sites are accessible, that they also have seating available, shade, water, and interpreter services. Also assuring the county provides transportation options to testing sites for lower income adults and people with disabilities, and that's in process. And then lastly, providing food access to those who are isolated and can't get into the grab and go sites, or folks that are under age 60 and maybe not eligible for Meals on Wheels or the state's Great Plates program. Second Harvest and the Health Trust have been providing some deliveries, and we really applaud all their efforts to expand to providing at-home meal deliveries and grocery deliveries. But we're also going to be expanding this to provide these services through partnerships with both the Health Trust and Perfect Strangers to provide home delivered groceries and hot meals. Next slide. As far as for SVLC, early on in May, started working on developing health and safety policy and guidance, utilizing templates from the CDC as well as the Public Health Appendix A for return to work in our office. Started immediately with communicating with the board and staff on a daily basis. We established a daily check-in at the end of the day from 4:30 to 5. Everybody goes on Microsoft Teams, and we have a staff meeting. And we did that 3 days after we started working remotely, and we continue on to this day. Also, as has been mentioned before from my colleagues, utilizing the public health checklist for guidance, and also establishing, making sure all the protocols are being addressed, and planning for reopening our offices, which we did the end of last week, and setting a target date for reopening, because there's lots to be done to plan and prepare for reopening. So if you have a target date in mind, then you have to work backwards and make sure that you have everything in place as far as a safe and healthy reopening. That include developing options and accommodations for at-risk employees. We developed a split schedule for staff to return to work, and that included either working Tuesday, Thursday, or Monday, Wednesday, and a few folks on Friday, so that we had no more than 10 staff in the office at any given time, and also separated in their workstations. Anybody who was at risk and could not return to work, then they were able to continue to work remotely from home. Also, it involved purchasing or obtaining PPE for our employees and our visitors. Most of that was obtained from donations through wonderful partners in the community or across the state. And then some items were also purchasing or creating safety equipment and signage for the building, distributing safety items, configuring, as I mentioned, the office layout to make sure that there are no congregate gathering places, no more lunch in the break room. Everybody has to eat their lunches either at their workstations or in separate rooms in the office, and to avoid congregate gatherings. And then also the plan included 3 days of office preparation without any visitors. So we were here basically preparing the office for a full 3 days before we allowed any one-on-one appointments. And we're only doing one-on-one appointments, no small groups or gatherings. Just wanted to show you a little bit of the signage that we have set up. We have our social distancing facility signage. We have signage that we made sure that is by the elevators. We are in a multi-story complex. I worked very closely with the property managers to make sure that the elevators had a maximum limit of 2 people per car, and that also everyone in the whole building is required to wear a face covering, and the owners are providing face coverings at the first floor entrance to the building, as well as we are if anybody happens to get to our suite without having a face mask. In the restroom facility, we have a lot of materials that have been made available, again, through Public Health, CDC, or Second Harvest. Since we are a pantry site, we got a lot of materials from them early on, which we really appreciated, and setting those up in the office. The lobby area and the reception, as you can see there, we have sliding glass doors that are part of the normal procedures for welcoming our visitors, but we put up a plexiglass sneeze shield there, and that allows for additional protection, as well as a pass-through underneath to pass materials back and forth. And then our workstations are now, when we're meeting with consumers or anybody one-on-one, is that we have a wide open area for that, again, with a plexiglass sneeze shield available. And those are all portable, so it's part of the health and hygiene. And one more slide, I think, is there. And again, the social distancing is part of it. So resetting up our conference room so that there are less tables in there, less chairs. Everything is at least a minimum of 6 feet apart. We have signage there that shows the measurements and a maximum capacity for each of our rooms. And also, if anybody is in an overflow with regards to our lobby, we do have the social distancing out in the hallway that you can see our staff is doing our modeling there for that. So those are some of the things that we have put into place to make sure that we have a safe and healthy environment to resume on-site operations.
Great. Thank you, Sherry. I'm going to move rather quickly. We have 3 more speakers for you. So our next up is Esther with Nextdoor Solutions. Esther?
Hi, Anna. Thank you very much. I know we're very short on time now, so I just want to give our general email to folks. If they have any questions or are interested in follow-up training, it's info, I-N-F-O, @nextdoor.org. And so what I want to say is we have a philosophy at Nextdoor Solutions in the 49 years we've been in operation that our work is survivor defined. Whatever it is that the survivor needs, is requesting, is what we respond to. And we build relationships over the long term. So I think it would be helpful because we also know we're not the only door that survivors come through. Many of the organizations here have been partners, have referred people to us that have disclosed domestic violence is happening. So we want to continue to encourage you to do that. Since COVID-19 went in and the shelter-in-place order went into effect, in conversations with other shelters in the Bay Area, we all experienced somewhat of a drop. For Nextdoor Solutions, we dropped about 38% in crisis calls, meaning the 40 phone calls we were getting on the average dropped pretty significantly. In the past 2 weeks, we see those numbers back to normal. And just in the past week, we've actually seen some spikes up in the upper 40s and in the low 50s. So calls are happening more and more now. And what we're hearing from the callers is violence and abuse has continued to happen. But I think survivors have been doing what they always do. They were worried about rent. They were worried about taking care of kids that were now no longer in school. And most significantly, they were sheltering with the person committing the abuse. So it's much harder for them to call us, much harder for them to come in. And so we moved to remote. We began using, video, emails, phone to stay in touch with our clients. It's not the same as an in-person contact, especially for an issue like domestic violence. So we want to make sure that we sort of highlight, some of the needs that we see. Some of the basic needs that we saw initially have sort of curved. And in the last couple of weeks, we've seen a lot more calls about safety planning, which is telling us the violence is escalating in the homes. And so we all need to be really ready and really mindful that when people come to us, they're not going to be at their best, number one. There's a lot of stress and anxiety around just COVID-19 and being sheltered in place. The other thing is, staff should have a very strong understanding of trauma, what it looks like and how it manifests. So I think in preparing to reopen, which we plan to do in July, we're already taking walk-ins back into the building. I'm sorry, not walk-ins, scheduled appointments for people that need specific help. But anxiety is very high with folks. People have trouble concentrating, have trouble recalling. So in agencies where you're asking a lot of questions about circumstances and maybe, what were you doing, for income over the last 6 months, I think we all just need to get a real good handle on what does trauma look like, because there's been a lot of trauma related to increased violence. There's been the trauma of the virus and the trauma of not knowing what the future holds. And so there's got to be a lot of empathy and patience. We also know this is happening with our staff. We have the range of people who are ready to come back, even when we announce we're, an essential workplace, so we need a team to stay. We had no problem having those employees stay. But as time went on, you could see some employees were struggling much more and the fear and anxiety was setting in. And then you had the others that were already here and they were just sort of a little bit tired. And so paying attention to trauma and sort of the emotional health is going to be the topic of other meetings, and that'll be great. I do think that part of how we prepared to come back to work is, number one, we kept operating, but we went and I think about 80% of our staff were remote. The rest were here practicing every safety protocol, and those have evolved. So if you've looked at them and it's been a while, you should probably revisit those, because we found new things, like the question earlier about masks and should you wear those at all times? And county council has advised yes. So we were all sort of practicing not wearing them at our desks and in our offices, but absolutely, it's about trying to keep the employees and the clients safe. In terms of staggered returns, we're doing that now. Every week this month, we're bringing back a few more people opening up. We hope, barring no spikes in the virus, that we're going to be fully functioning. Right now, all the domestic violence agencies are open and operating and serving people. So if you're getting requests for shelter, for hotel, there are definitely resources. I would say with domestic violence, the best advice I can give you is get into a warm relationship with us, with the 5 agencies that are here in Santa Clara County. They are Next Door Solutions, the YWCA Silicon Valley, Community Solutions, Asian Americans for Community Involvement, or ACI, and MyTree. We all have our specialties. We all have our cultural communities that we serve best. You should make time to get on a meeting, a Zoom meeting, or make a call to kind of find out what's the process. The biggest frustration is requests for shelter, because as much as we try to stay coordinated, it's a constantly moving target. So if you're working with survivors of domestic violence, we want to help you. We want to be in a relationship, a deeper relationship, so we'll be able to help you when you have those referrals. And so we don't send people on a wild goose chase and sort of making call after call trying to find help. So again, info@nextdoor.org is where I would love to hear from any of you if you're interested in training. If you'd like to know how to do a little bit of screening and universal education on domestic violence with all of your clients, that's going to go a long way in helping us identify who needs help out there. And again, we're short on time, but I'm happy to have more discussion with any of you. If you want to call me, my number's 408-501-7555. And we thank you for your partnership and wish you luck.
Great. Thank you so much, Esther. Really important information and really good content. We know we're running a little short on time. We have 2 more presenters. I want to let you know that we are going to continue forward. We might go beyond 2:30 a little bit. The session is recorded, so if you do need to drop off, you can grab the last few minutes at a later date. So next up to share with us is Sujata with West Valley Community Services.
Thank you so much. Like everybody said in the call, the panelists, West Valley Community Services continue to offer our programs. We had to make some changes to our service delivery. We were able to adapt and make those changes that were necessary, like social distancing, contactless, case management. And so nothing changed as far as programs and services were concerned. So I will split my presentation today on just logistics and then the changes we did to some of our programs as far as the service delivery is concerned. So logistics, we created a morning and an afternoon staggered schedule. We are continuing to do that. We wanted to make sure that the morning staff and the afternoon staff, they have the handoff over a phone or an email, but that we keep that separate. Right now, we have a few staff who have that role to do the warm handoff. So we are continuing with our staggered schedule and limiting the number of staff who are coming to the office. The next thing we did is increase communication. So we set up a daily huddle meeting with the directors and managers so that we're all on the same page. And then we also started doing every other day meetings with the case managers and service delivery staff so that they are aware of any changes or information that needs to be passed on. We have a weekly newsletter that goes out to clients with information that we get from different sources, the county, the city, and also the public health department. When the information is very critical, we send out text messages and using the social media. So we really upped communication, which we felt was very critical, that the right information is passed on at the right time. Now, as far as programs and services, as an emergency assistance network agency, our 3 core services, we were able to continue: the food pantry, then our emergency financial assistance, and also case management and information and referral. The service delivery widely changed for the food pantry. I'm sorry, I'm not on Zoom, but you will be able to see some slides. Now, because the office was not used, we used the lobby and set up different stations so that volunteers who are bagging the food are able to maintain social distancing, and we moved from a shopping pantry to a grocery bag pickup for clients. We also created the same model for our mobile food pantry, as a lot of food also gets distributed through our mobile van, and that has continued. And we are also doing senior grocery drop-off for our seniors. As far as the emergency financial assistance was concerned, we quickly moved to a system which was contactless but made easy for the client. So we set up almost like a contact center phone line where the client would get the same experience they would get if they called the lobby or walked into our lobby. So someone was picking up a call and answering their question or providing them the services they need. We moved to Google Hangouts, Zoom, and other video conferencing methodologies to provide face-to-face or on a video contact for clients who really needed that. Recently, we've also seen some clients who don't have access to a phone or an internet, so we are set up a system with shower curtains. We bought those, plexiglass, and set up a way that there's a barrier where we can still have that contact with a conversation with the client, but providing the safety measures both for the client and the staff. So these are some of the changes that we did. We have seen an uptick in the need in our community. You will see in my slide, that was from last week, but it's about 500% increase in new households accessing our services, about 200% increase in the need for rental assistance. We are doing about 46 senior food deliveries right now, and about 100 plus families from the Moreland School District are accessing our services. So as you see, the needs are going up, but so far with the setup that we have, we are able to meet that need. I'm happy to say that we continue to provide the services as an essential service and a basic need organization. We are able to do that, and hopefully this would continue and we will be able to safely support the community that we serve. Thank you so much.
Thank you, Sujatha, and thank you for all the good work at West Valley. Our last speaker this afternoon is Diane Ratcliffe with Community Solutions. Diane?
Anna, this is Wendy. It looks like Diane had to sign off.
Okay, so Diane had shared with us as Community Solutions, for those of you who are still on the line, they're another one of our community-based organizations in Gilroy, and they did share with us, they have this draft working document that you see on the screen here today. It is a draft, and it's been put together with various research that they have done to guide their organization services. They have a staff of nearly 350. About 90% of them are office-based, 10% are residential-based. They too never shut down, but they wanted to share with the group that they too are doing daily email communication, virtual huddles with all of their managers, looking at changing procedures to support compliance. One of the things I would say that Community Solutions was offering up as part of their testimony last week with the Board of Supervisors are some of the things that work for them and some of the things that aren't working. So I don't want to speak on behalf of the organization, but that if you are looking at some of the office procedures and want to kind of tap the experience of one of your peers, I'd urge you to reach out to us, and we'll connect you with Diane for more detailed information on that. And with that, we are just a couple of minutes over. I'm going to turn the program back to Marcia in just a moment. Our last segment is The Journey Continues. We know that technology has played a critical role as we all work to pivot to these new realities. And so with that, I'm going to turn the closing remarks over to Marcia for what's coming up next.
Right, thanks, Anna. Gosh, such good information. Please fill out the evaluation that you get after this webinar. We are funded a contract on emergency preparedness, and the feedback that we get in the evaluations helps us get more money. So please do that. We will put some resources. There were a lot of asks for links. All of the links will be posted on the CADRE and the SVCN website, as well as the recording. And next slide, of the dates for the continuation of the series that we're in right now. June 23rd is the next one. And you can see them on your screen. The registration information will be on the SVCN and the CADRE website. So hopefully we'll see you back then. The June 23rd, 1 to 2:30 is that next webinar. And that's it. So we'll close this out. Thank you all for your participation, and we'll see you on the next webinar.